As we cross the age of 50, the body begins to change in predictable ways. Muscle mass gradually declines, balance becomes less reliable, and the risk of falls increases. Among all muscle groups, the glute muscles play a critical but often overlooked role in maintaining stability, posture, and safe movement. Strengthening them does not always require standing exercises or heavy effort. Today, the focus is on simple, seated glute exercises that are safe, effective, and especially suitable for older adults after the age of 50. Many individuals begin to notice subtle changes in their balance, often without realizing why it is happening. From a medical perspective, balance is a complex system that depends on muscle strength, joint stability, vision, inner ear function, and the nervous system working together. As the body ages, each of these systems experiences gradual decline, and the combined effect becomes more noticeable in daily movements such as walking, turning, or standing up from a chair. One of the most significant contributors to balance decline is the natural loss of muscle mass, known as age-related muscle weakening. The muscles responsible for stabilizing the hips and pelvis, particularly the glute muscles, tend to weaken when they are not actively used. This reduces the body's ability to maintain proper alignment, causing instability during movement. Even strong upper body muscles cannot compensate for weak lower body support. Joint stiffness also increases with age due to reduced cartilage health and decreased fluid in the joints. This limits the range of motion in the hips, knees, and ankles, making quick adjustments more difficult when balance is challenged. At the same time, nerve signals between the brain and muscles slow down, delaying reaction time and increasing the risk of missteps. Another important factor is reduced physical activity. Many adults become less active after 50 due to discomfort, busy routines, or fear of injury. Unfortunately, inactivity accelerates muscle weakness and balance loss. Vision changes and inner ear sensitivity further affect spatial awareness, making it harder to judge distances and body position. Balance decline is not a sudden event, but a gradual process. Understanding these changes is essential, because balance can be improved with targeted exercises that rebuild strength, coordination, and confidence in a safe and controlled manner. The glute muscles play a central role in senior health, yet they are often overlooked until weakness or discomfort appears. From a clinical standpoint, the glutes are among the largest and most powerful muscles in the body, responsible for stabilizing the hips, supporting the spine, and controlling nearly every lower body movement. As individuals age, these muscles tend to weaken due to prolonged sitting, reduced physical activity, and natural muscle loss, which can significantly affect overall mobility. When the glute muscles are strong, they help maintain proper posture and alignment. This reduces unnecessary strain on the lower back, hips, and knees. In seniors, weak glutes often force the body to rely on smaller muscles and joints that are not designed to carry excessive load, leading to chronic pain, joint degeneration, and increased injury risk. Many cases of lower back discomfort and knee instability in older adults can be traced back to insufficient glute strength. Glute muscles also play a critical role in balance and fall prevention. They help control side-to-side movement and keep the pelvis stable during walking, standing, and turning. Without adequate glute activation, even simple tasks such as rising from a chair or climbing stairs can become challenging and unsafe. This loss of confidence in movement often leads seniors to limit activity, further accelerating muscle weakness. In addition, strong glutes improve circulation and support metabolic health by encouraging more efficient movement. They assist in maintaining independence, allowing older adults to perform daily activities without assistance. Preserving glute strength is not about intense workouts, but about consistent, targeted engagement that supports long-term mobility, safety, and quality of life. After the age of 50, the approach to exercise must shift from intensity to safety, control, and consistency. Seated exercises are particularly effective because they reduce stress on the joints, while still allowing important muscles to remain active. From a medical standpoint, many injuries in older adults occur due to loss of balance, sudden movements, or poor joint support. Exercising in a seated position significantly lowers the risk of falls, while providing a stable base for movement. As the body ages, conditions such as arthritis, joint stiffness, lower back discomfort, and reduced flexibility become more common. Standing exercises may place excessive pressure on the knees, hips, or spine, discouraging regular participation. Seated exercises allow individuals to strengthen muscles without placing full body weight on sensitive joints. This makes movement more comfortable and sustainable over time. Seated exercises also encourage better posture and controlled breathing. When seated correctly, the spine is supported, reducing strain on the lower back and neck. This allows seniors to focus on proper muscle engagement rather than compensating for instability. Controlled movements improve coordination and help retrain the nervous system to communicate more effectively with muscles that may have been inactive for years. Another advantage of seated exercises is accessibility. They can be performed at home, in clinics, or in community settings without special equipment. This removes common barriers, such as fear of injury, lack of space, or limited mobility. Consistent practice of seated movements improves circulation, muscle activation, and confidence in physical ability. Most importantly, seated exercises serve as a foundation for safe progression. As strength and balance improve, seniors regain trust in their bodies, making it easier to transition to standing activities when appropriate while maintaining long-term health and independence. The seated glute squeeze is one of the safest and most effective exercises for activating and strengthening the glute muscles, especially after the age of 50. From a clinical perspective, many seniors experience glute inactivity due to prolonged sitting and reduced movement, which causes these muscles to become weak and unresponsive. This exercise helps restore the connection between the brain and the muscles, an essential step in rebuilding strength and stability. To perform this movement, an individual sits upright in a chair with both feet flat on the floor and the spine in a neutral position. The focus is placed on gently tightening both glute muscles, as if trying to lift the body slightly off the chair. Without actually standing, the contraction is held for a few seconds and then slowly released. This controlled action allows the muscles to engage without placing stress on the knees, hips, or lower back. The primary benefit of the seated glute squeeze is improved pelvic stability. Stronger glute muscles help support the lower spine and reduce excessive strain on surrounding joints. Over time, this can lead to reduced lower back discomfort and improved posture. The exercise also enhances circulation in the hip and pelvic region, which is particularly beneficial for individuals who sit for long periods. Another important advantage is its accessibility. This exercise can be performed anywhere, multiple times a day, without equipment or special preparation. It builds muscle endurance gradually, making it ideal for seniors who are just beginning an exercise routine or recovering from inactivity. With consistent practice, the seated glute squeeze improves balance, supports daily movement, and lays a strong foundation for more advanced exercises. Seated marching is a highly effective exercise for improving lower body strength, coordination, and balance in adults over 50. From a medical viewpoint, this movement closely mimics the natural walking pattern while eliminating the risks associated with standing or unsupported motion. As aging progresses, many individuals lose hip strength and control, which directly affects gait and stability. Seated marching addresses these issues in a controlled and safe manner. To perform this exercise, the individual sits upright in a chair with feet placed flat on the floor and hands resting lightly at the sides or on the thighs. One knee is lifted slowly toward the chest while maintaining an upright posture, then gently lowered back to the starting position before alternating with the opposite leg. The movement should be smooth and deliberate, allowing the muscles to work without momentum. Controlled breathing during each lift helps improve oxygen flow and muscle endurance. Seated marching primarily activates the glute muscles, hip flexors, and core stabilizers. Strengthening these muscles enhances pelvic control, which is essential for safe walking and balance. This exercise also improves coordination between the brain and muscles, helping seniors respond more efficiently to changes in position. Over time, it supports better step control and reduces the risk of tripping or shuffling while walking. Another important benefit is improved circulation in the lower limbs. Lifting and lowering the legs encourages blood flow, reducing stiffness and swelling commonly experienced with prolonged sitting. Seated marching is especially beneficial for individuals with limited mobility, joint discomfort, or fear of falling. When practiced regularly, it builds confidence in movement, reinforces functional strength, and prepares the body for everyday activities such as standing, walking, and climbing stairs with greater ease and safety. The seated leg extension with glute activation is an effective exercise for strengthening the glute muscles while also supporting knee stability and posture in adults over 50. From a clinical perspective, this movement targets multiple muscle groups in a controlled environment, making it especially valuable for seniors who need to improve strength without placing excessive stress on the joints. Weak glutes often lead to poor leg alignment and increased strain on the knees, which can contribute to pain and instability over time. To perform this exercise, the individual sits upright in a chair with the back straight and feet flat on the floor. One leg is slowly extended forward until it is nearly straight, while the glute muscle on the same side is consciously tightened. Holding this position for a few seconds allows for deeper muscle engagement and improves neuromuscular control. The leg is then gently lowered back to the starting position before switching to the other side. The movement should be slow and steady, avoiding any sudden or jerky motions. This exercise strengthens the glutes and quadriceps simultaneously, which is essential for tasks such as standing up from a chair, walking, and climbing stairs. By engaging the glutes during the leg extension, seniors improve hip stability and reduce the tendency to rely on the lower back or knees for support. This promotes better posture and more efficient movement patterns. Additionally, the seated leg extension with glute activation enhances circulation and joint mobility in the hips and knees. Regular practice helps reduce stiffness, supports balance, and builds confidence in leg strength. Over time, this simple exercise contributes to safer movement, improved independence, and a stronger foundation for daily activities. As we come to the end of this discussion, it is important to remember that aging does not mean giving up strength, balance, or independence. After the age of 50, the body simply requires a smarter and safer approach to movement. The 3 seated glute exercises shared in this video are designed with that exact purpose in mind. They focus on rebuilding strength where it matters most, without placing unnecessary stress on the joints or increasing the risk of falls. Balance and stability begin at the hips, and strong glute muscles provide the foundation for safe walking, standing, and daily movement. When these muscles are activated regularly, posture improves, confidence returns, and everyday tasks become easier. These exercises may appear simple, but when performed with proper form and consistency, they create meaningful changes in mobility and overall health. What matters most is not how hard an exercise is, but how consistently it is practiced. Even a few minutes a day can help reawaken inactive muscles, improve circulation, and restore coordination between the brain and body. Seated exercises offer a safe starting point for nearly everyone. Regardless of fitness level or physical limitations, the goal is long-term independence, reduced fall risk, and improved quality of life. Small, controlled movements done daily can protect joints, support balance, and help maintain strength well into later years. With patience and regular effort, the body can remain strong, stable, and capable at any age.